Hey there, compliance professionals. Welcome to today's video. I'm Clarice Warner, the girl with the pearls, and I'm thrilled to dive into a crucial topic with you today. Today, we're going to talk about something that's been making waves in the healthcare industry, the ChristianaCare qui tam settlement. But don't worry, we're not just here to discuss problems, we're here to find solutions. So grab a pen and paper because we're about to break it down. First off, let's unpack what exactly happened with the ChristianaCare settlement. ChristianaCare, a major healthcare system in northern Delaware, paid a whopping $42.5 million to resolve allegations of healthcare fraud arising under the Federal False Claims Act and the Delaware False Claims and Reporting Act. That's no small amount, folks. This settlement arose from a whistleblower complaint filed back in 2017 by ChristianaCare's former chief compliance officer. The complaint alleged that ChristianaCare had provided illegal remuneration to non-employee neonatologists and surgeons by offering services from ancillary support providers, including nurse practitioners, hospitalists, and physician assistants, to inpatients at ChristianaCare hospitals. This was the first ever False Claims Act settlement based on allegations of providing private physicians with free services. Now, if you're like me, this probably raised a few red flags. What does this mean in terms of compliance? Well, it's alleged that these services were offered to induce referrals to ChristianaCare hospitals, which could potentially violate federal anti-kickback statute and the Stark Law. These laws are in place to ensure that medical decisions are based on patient care, not financial gain. It's essential for us as compliance professionals to understand the gravity of these allegations. The implications go beyond just one healthcare system. They serve as a wake-up call for the entire industry. Let's talk about the legal process involved. A whistleblower suit or qui tam action under the False Claims Act is commenced by an individual filing a complaint under seal in the U.S. District Court. The United States then investigates the claims, and if successful, the whistleblower receives a share of the government's recovery. Remember, these allegations are just that, allegations. There's been no determination of liability. But that doesn't mean we can ignore the lessons to be learned here. So what can we take away from this case? It's clear that compliance is more critical than ever. We need to educate ourselves and our teams, conduct thorough internal reviews, and implement robust risk mitigation strategies. Think about it. Any hospital operating under a similar model could potentially be at risk of facing similar whistleblower lawsuits. That's why it's crucial for compliance professionals to stay ahead of the game. So what can we do about it? Well, I've got a few strategies up my sleeve that I'm excited to share with you all. So let's dive in. Strategy number one. Educate, educate, educate. It's essential to ensure that everyone in your organization, from the C-suite to frontline staff, understands the implications of the ChristianaCare settlement. Knowledge is power, folks. This means providing comprehensive training to our teams about the implications of the ChristianaCare settlement and the importance of compliance with healthcare regulations. For example, we could host workshops led by legal experts to ensure everyone understands the intricacies of the anti-kickback statute and the Stark Law. By investing in education, we empower our teams to make informed decisions that prioritize patient care and compliance. Strategy number two, conduct an internal review. Let's take a closer look into your organization's practices to identify any potential areas of non-compliance. Get your team involved and don't be afraid to ask the tough questions. For instance, we can review our physician arrangements and financial relationships to ensure they comply with fair market value principles and are properly documented. So by conducting regular internal reviews, we can proactively address any compliance gaps before they escalate into larger issues. Remember, it's better to catch issues early on than to wait for a whistleblower to come knocking at your door, right? Right. Strategy number 3. Implement risk mitigation strategies. This can involve revising policies and procedures, enhancing monitoring processes, and providing targeted training to staff members involved in physician arrangements. One example could be enhancing our monitoring and auditing processes. We can utilize advanced data analytics tools to monitor financial transactions and identify any anomalies that may indicate potential compliance risks. By leveraging technology, we can strengthen our compliance efforts and ensure we're staying ahead of the curve. And by taking proactive steps to mitigate risks, we can protect our organizations and ensure compliance with healthcare regulations. Now let's talk about alternative operating models. It's time to get creative, folks. One option is to explore compensation arrangements. For example, instead of providing free services to physicians, we can explore structured compensation arrangements that comply with fair market value principles. This ensures transparency and helps mitigate the risk of violating anti-kickback laws. Transparency is key here. And don't forget to engage legal counsel. These folks are your best friends when it comes to navigating complex regulatory requirements and mitigating legal risks. By working closely with legal counsel, we can ensure our compliance efforts are aligned with industry standards and best practices. Trust me, you'll want to have them on speed dial. Last, but certainly not least, foster a culture of compliance within your organization. Encourage open communication, accountability, and ethical behavior among your team members. Compliance isn't just a checkbox, it's a mindset, and it starts with each and every one of us. Well, that's a wrap for today, folks. I hope you found this video helpful. Usually, this is the time when I ask you to comment and find out if this is how your organization operates, but we don't know who may be watching, so just say hi in the comments if this was valuable information. Remember, compliance may be complex, but together we can tackle any challenge that comes our way, so stay compliant. Until next time, I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network LLC, where coding education is key. And if you want to know more about medical coding, compliance, the revenue cycle, and healthcare in general, well, watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Take care, and thanks so much for watching.